Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for joining us today.
Well, thank you very much for having me once again.
Okay, Minister. So besides the biggest news today, which is the budget, we are expecting 20,000 doses of the Sinopharm vaccine from China. Now, I know yesterday you would have said that with the 3,000 doses we would have received from Barbados, we would have sent that across several regions. Is there any region that has not received any vaccines as yet?
I think we cover all the regions because we identify the people who are dealing directly with COVID-19 patients, whether they're doing testing or whether they interface with potential patients, and try to get the vaccines to them first. So now that we have more or less completed that process, we would now go back with these new vaccines that we're getting, and we'll distribute it accordingly. So we want to cover as much of the people in the front line as possible. With 20,000 doses means that we'll be able to immunize 10,000 people. So that's what we'll be using it for.
Okay. Minister, I know yesterday during our update you would have said that the ministry is working with the Ministry of Social Protection to identify those elderly persons through their pension scheme. Is this being done throughout the region, or is it just Region 4 right now on the coast?
No, it's going to be done throughout Guyana because I think the Ministry of Social Services, they have a very comprehensive database. It's based on that database that pensions are being paid, and so they cover quite a lot of people. And we're going to be using that. We're also going to be taking the vaccines into the homes of the elderly. So wherever those homes exist, we are going to go there as well. They're kind of captive audience, so we'll be able to complete them very quickly.
Okay. Minister, when you say homes of the elderly, you're speaking specifically to geriatric homes?
Yes.
Okay, what about those persons who might not be physically able to go to where the vaccines are being administered?
When we talk about the homes, we're actually going to go to that institution and do the vaccination on site.
Okay, I understand that, but in terms of persons who are, say, like they're bedridden, they're at their homes, they're not in any institution, how are we going to treat with that?
Those, once we've been able to identify those persons, we'll be able to have a special team that would come to the home and be able to give the vaccines.
Okay. Is there a specific age cutoff to receive these vaccines? I mean, for the elderly?
Right now, it's we have pegged it at 60 years and above. But once we get enough vaccines, we're going to lower that age range. So our intention, we are starting at 60 and above, but we can lower that as we get more vaccines coming in.
Okay. So persons above 60 will get it or won't get it?
Would
For clarity,
get it.
they wouldn't?
Yeah, they would get the
Oh, okay.
vaccine. Once you're 60 years and above, so the vaccines are going to be rolled out in different stages. First stage is health workers, all categories. Second stage, people who are older, so 60 years and above. Third stage, people with some form of underlying illness, so whether things like diabetes, hypertension, and so forth, and that might be even younger people. So if you are 40 and you have hypertension or diabetes, then you become eligible. So that does not have an age cutoff. The criteria there is that you are at risk because of the underlying illness.
Okay.
So we'll be able to do a lot of other people in that category. And after we have completed that, then we're going to go to other persons in the population.
Okay, Minister, thank you for that. Now we have a question we actually have two questions from the Guyana Times. They're asking if Guyana will be donating any vaccine it receives to any fellow Caribbean nation.
We haven't ruled that out, and it depends if any one of those countries probably have a need. So we haven't ruled that out. So something that we can look at later on.
And their next question is, as persons who are often interacting with the public, will the first family and members of the cabinet be among the first to take this set of vaccines?
At some point, and His Excellency the President would decide when the government, the cabinet, would take the vaccine. But our priority as of now is to ensure that those categories that I've mentioned, that they get the vaccine. Of course, cabinet and so it is a smaller group of people, so it wouldn't take up a lot of vaccines. But that's a consideration that we will make after the health workers would have gotten their vaccines.
Okay, thank you so much for that, Minister, and thank you for facilitating us today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.